Hey, I'm going to be going over the treatment for the different types of hepatitis. In hepatitis A, the treatment includes one dose of single antigen hepatitis A vaccine for those who have not been vaccinated, or immunoglobulin within 2 weeks after exposure. To prevent hepatitis A, the hepatitis A vaccine 2-dose series should be given at 1 year of age and older. Since the virus is transmitted through the fecal-oral route, preventing includes good hand hygiene like hand washing after using the bathroom, changing diapers, and before preparing or eating food. In hepatitis B, during a hepatitis B acute infection, there is no medication available. This is because in hepatitis B, more than 90% of acute hepatitis B cases will spontaneously clear the infection, and there is no treatment necessary. However, there is treatment available for patients with chronic hepatitis B. This includes interferon alpha to reduce the growth of cancer cells, interferon alpha that decreases the swelling in the liver. Antiviral therapy includes lamivudine, adefovir, entecavir, tilvivudine, and tenofovir. Recommendations to prevent transmission of hepatitis B include the universal vaccinations of 3 intramuscular injections of infants beginning at birth, screening of all pregnant women to prevent perinatal infection, and immunoprophylaxis of infants born to hepatitis B virus surface antigen positive women. Hepatitis C. Patients with acute hepatitis C infection should only be considered for treatment if the hepatitis C RNA persists after 6 months. Treatment options include interferon, interferon alpha. The cure rates are now greater than 95% due to the therapy influenced by hepatitis C genotype. The guidelines are based on the patient's genotype and if there is cirrhosis or compensated cirrhosis. The therapy is a fixed-dose combinations of direct-acting antivirals including ribavirin, elbasvir, griselprevir, lidispersvir, sofosbuvir, and others. Hepatitis C. In hepatitis B and D co-infection, it is usually a self-limited illness that resolves after a few weeks. However, the only therapeutic option is the interferon alpha. There is no vaccine available for hepatitis D, but vaccinating against hepatitis B can help prevent hepatitis D because hepatitis D cannot cause an infection without the help of HBV. Okay, and lastly we have hepatitis E. Hepatitis E usually resolves on its own. There is no specific antiviral therapy. And supportive therapy, which is also recommended in other types of hepatitis, includes adequate rest, nutrition, fluids, avoiding alcohol, and any medications metabolized by the liver. But hospitalization is sometimes required in severe cases, and it should also be considered for pregnant women in the 3rd trimester. For prevention, there is no vaccine available in the US, but ways to prevent hepatitis E relies primarily on good sanitation, having clean drinking water available, and this is a risk when traveling to developing countries and drinking unpurified water. Also avoiding raw pork and deer.